Hi, I'm Dr. Preston Parry, and we have a really common question for today, which is what things increase a woman's risk of infertility? Now, there's a lot of craziness out there for what things do, and people are told, you have to have boxers instead of briefs and cold showers and Geritol and Robitussin and pineapple core while the hips are in the air for 15 minutes. And those things, it's so hard to say that they matter. The research studies really haven't shown a benefit to doing all these things. And so I don't want people to feel guilty if they aren't doing it. It's not that people can't get pregnant after doing it. It's that the amount of benefit is so small, science can't prove that it helps. So we look at other things that do help for lifestyle modification, and this is reducing smoking, because smoking can age the ovaries and lead to poor quality DNA for the eggs or the sperm, or it's weight loss, getting into a healthier range, and you don't have to necessarily be that BMI of 20 to 25, even 25 to 30 for being a bit overweight. It seems to have a more subtle effect. But as you get past 30, and especially over 40 or 50 for your body mass index, which is a measure of your weight to height ratio, or if you're below 20, you can see effects from being too thin. These things sometimes matter for whether or not a pregnancy will take and what chances are. However, for what things affect fertility, you're often looking, does the woman have enough eggs? Or, again, are there too many for PCOS? Are there too few for ovarian failure? Have there been infections to scar the pelvis through pelvic inflammatory disease, or ruptured appendicitis, or endometriosis that also can inflame the eggs on top of scarring the tubes where sperm and egg can't find each other? Or have women developed problems for the uterus? And these can be infections, these can be scarring, these can be polyps, these can be fibroids, multiple things that have an effect. And in most of these, unfortunately, you actually can't control just by saying, oh, I am doing the right healthy lifestyle. There are so many women who live good, healthy lifestyles and still can't get pregnant. These are things also that are often invisible, and you need testing by a physician or a clinician to understand whether you have them. For a lot of the tests that are on the internet, send in this kit, we'll tell you your fertility. It's nice to know that you have good ovarian reserve, but good ovarian reserve won't open up blocked fallopian tubes. It won't cause fibroids to go away that are pressing in on the cavity and making it so a pregnancy won't attach. It won't cause the male sperm to improve if you're testing the woman. And so I think that there are a lot of things that can drive fertility that are best understood through the support of someone who can actually look at your pelvis, know where it is, and give really feedback and basically an answer that is more comprehensive than just an egg issue. But again, if you want to understand and improve things, talk to a clinician, ask us. We'd be happy to help. Share knowledge with other people so they aren't going through things alone. And any more questions you want us to answer, send them in, and thank you for watching.